Well, these numbers are tough to hear. Just last year, more than 5,200 Ohioans died in our state's opioid epidemic. Statistics show the overdose death rate in Ohio has increased 26%. So what can be done about this deadly trend? For some answers, we are turning now to the founder of Comprehensive Pain Management Institute. I'm happy to welcome back to the show Dr. Leon Margolin from the Comprehensive Pain Management Institute. It's so good to have you with us, Doctor.
Thank you for inviting me.
This is a serious topic, obviously, and you see firsthand, really, the impact of opioid addiction. So talk about who is most at risk.
Well, statistics shows that ages 18 to 45, mostly at risk with opioid overdose deaths is #1 killer. And unfortunately, mortality overall across ages is about 26% up.
Share with us what you believe then can help in this growing problem.
The consensus is that screening and brief intervention, early detection, is the way to go. The earlier you diagnose the person, the higher chances to treat and to help him or her.
And so you also work with insurance companies. So screenings, navigating this, tell us how you handle that.
We do deal with insurance companies. We try to advocate, publish, and communicate with them. Unfortunately, sometimes it is a challenge. Most of the people who need screening, they have government insurances or HMOs. And there are challenges. If you read my article we published about CareSource, there were challenges related to Medicare and factors that make decisions about Medicare coverage. The most recent example, Molina, which is a big HMO in Ohio, withheld more than $30,000 abruptly for screening brief intervention, claiming that it's not a necessary service. Eventually, they refunded us, but the discussion is still going on whether or not Molina is covering these services. And this is very concerning because these are life-saving services that make a huge difference, both in terms of saving life and even economically. They're not expensive and they prevent huge medical and societal costs in the future.
And then that leads us to exactly what it is you do, doctor. There are thousands of people we know who still require regular pain medication. So how is it that you help them manage that treatment?
First, we spend time. Sometimes mistakes happen because people cut corners, people rush, people don't screen enough. We actually performed a very thorough screening, which includes functional assessments, which includes psychological screening. We work with 3 or 4 pain psychologists who are our consultants. We work with pharmacology doctors who help us to analyze urine screens. We also do a comprehensive physical exam, and we create a comprehensive multidisciplinary plan that takes all pieces of the puzzle into consideration, meaning what is the organic pathology, what is the psychological factor, social economic factor, what is the functional status. And when you create a thorough plan, you communicate it to the patient, you help, you advocate for the patient to get it covered by insurance, the rate of success is much higher.
Doctor, your protocols put patient safety first. It is considered one of the safest in Ohio. You have received accolades, in fact, among your peers. That has to be important and assuring to your patients.
Oh, thank you. I hope so. If you or your loved one needs opioid medication, you need to look at the safety of the program. Again, it's killer #1, ages 18 to 45. In other age groups, it's on the rise. And making sure the care is provided in the most efficient and safe way is crucial.
It's also worth mentioning you were just recently named a top doctor by OH Top Docs. That must make you proud of the work you do. So people out there who may be struggling, doctor, they think they, could use your help. How do they get in touch with you and get that started?
Yeah, we have 2 offices in Cleveland and Columbus, Ohio. You can reach us by phone, or you can even email us through our website.
Absolutely. So we want people to know, though, they don't have to live in pain. There is help out there. There is safe help out there. So cpmiohio.com, the number up there as well. Dr. Margolin, thank you.
Thank you.